Hello everyone, so we are going to present collaborative group assignment part 2. It is presented by me, Baljinder Kaur, Ramandeep Kaur and Harpreet Kaur. So we choose the elderly people in Toronto City for this present. Outlines for this presentation. Firstly, parameters of community assessment, rationale of assessment, assessment methods, source of information, barrier that faced by the elderly people, strategies to overcome the barriers, benefits of assessment, limitation of assessment, advocacy and ethical consideration. So firstly, I will discuss the parameters of community assessment. Determining the criteria of neighborhood under evaluation is crucial for evaluating the demands of Toronto senior population. This cover elements including geographic location, socioeconomic status, and age range. The community for purpose of this assessment shall be defined as all those 65 years of age and older who reside within the boundaries of Toronto, regardless of their socioeconomic position. So, next is rationale for assessment. Developing demographic with specific requirements and concern is Toronto's older population. Their underserved and neglected status as a community make us feel that it is our duty to address these problems and enhance their quality of life. Through our assessment, we will be able to create a community development project that is specifically targeted to the needs and well-being of this demographic, uh, giving us important insight into their unique wants and concerns. So I will explain assessment methods. Firstly, windshield survey. This survey will be distributed to the representative sample of Toronto's elderly population to gather information about their needs, preferences, and experience. This survey will be designed to be accessible and easy to understand for elderly individuals with varying level of cognitive and physical ability. Next is focused group. Focused group will be conducted with small group of elderly individual to gather in-depth information about their experience and perspectives. Next is one-on-one interview. Social worker and other trained professional will conduct one-on-one interview with elderly individuals who may be unable or unwilling to participate in survey and focused group. These interviews will be conducted in sensitive and respectful manner and will provide valuable insight into the needs and experience of Toronto's elderly population. So next is source of information. Firstly, government agencies. These sources will provide with the demographic information, health statistics, and policy documents related to the elderly population in Toronto. Community organization. These organizations will provide us with information on the services and programs that are available to the elderly population in Toronto, as well as insight into the challenges and opportunities facing this population. And next is the individual interview and survey. So we will conduct interview and survey with elderly residents of Toronto as well as their caregivers, family members and service providers. These interview and survey will provide us with first-hand accounts of experience and needs of the elderly population in Toronto, as well as insight into the gap and opportunities in the current service landscape.
Hello everyone, my name is Harpreet Kaur and I'm going to discuss further slides, that is barriers, which include cultural disparities, transportation limitations, language barriers. First of all, in a culture disparity, it includes different people have a different culture values, so it may create a culture barrier. Transportation limitation in some states and in cities, people are unable to move due to transportation difficulties. So in the last, language barrier, it is also a common barrier because people are unable to communicate with each other due to a language barrier. In the next slide, I'm going to discuss a solution for this barrier. First of all, to overcome them, we can collaborate with our local leaders and organization who can build a relationship and trust with these groups, and we can also assist. First of all, government should provide a good transportation system to the public so they can able to communicate with one city to another, and arrange for meetings and event space that are easily accessible to this population. And the last one is a translator. It is also very mandatory because people are having a problem to communicate with each other, so with the help of translate, they can discuss their problems with each other. Next is gatekeepers. Social workers, medical professionals, and local authority are some of the gatekeepers in the community of senior citizens. These people can offer connections and insight for the assessment process, since they can build a close relationship with a senior population. Next is the stakeholders. Family members, volunteers, and caregivers are among the stakeholders in the community of these the senior population, because they care about the welfare of the senior citizen population, and these people can offer insight, criticism, and encourage throughout the assessment process.
Hello Professor, my name is Ramandeep Kaur and I am going to describe about a strengthen in which the requirements and challenges faced by the senior population could be better understood by combining qualitative and quantitative methods. The second one is accurate representations of the needs and concerns of the senior population was made possible by involving community members in the evaluation process. The another thing is the findings and results were validated and triangulated with the aid of the data sources such as focus groups, questionnaires, and interviews. Further, I am going to describe about a limitation in which a significant portion of the assessment was based on self-reported data, which isn't necessarily dependable or accurate. The evaluation was restricted to a certain region of the city and might not accurately reflect the requirements and difficulties faced by the senior. The another thing is the opinions of family members and caregivers of the older population were not considered in the assessment, which would have given important insights into their needs and difficulties. Moreover, we have advocacy and ethical considerations in assessing the needs of Toronto's elderly population, in which promoting the rights and interests of the elderly, such as their access to social services, housing, and healthcare, is the goal of advocacy. Additionally, it entails a promoting laws and initiatives that help the elderly, like a senior citizens and transportation services. There are several ways to engage in the advocacy, including through advocacy groups, governmental organizations, and local communities. Next, ethical consideration. As part of the assessment of the elderly needs, it is ethical to make sure that their demands are satisfied in a fair and courteous manner, taking into account matters like privacy, accessibility, and cultural diversity is a part of this. Not discriminating against on the basis of their age or any other factor is another aspect of it. Policies and programs that encourage inclusivity and respect of the elderly can address ethical issues. These are references. Thank you.